So, Mr. Melly Mistry, Ms. Sakar Mistry, I'm privileged to have Mr. Mistry as my patient for his hearing health care. And Ms. Sakar Mistry was the very first speech therapist in India.
Actually, Dr. Ratna, he was in Mysore. So Dr. Ratna and myself, we worked together. We started I started the Nair speech department, actually, 100 years ago.
Wow. Which is also where Dr. Vora taught for some time. And
That's right. And then, of course, Ramesh Oza, took it, to a different level, and then it became a university,
Teaching institute.
a teaching institute.
The very first of its kind in India.
Yeah, but earlier on, we had an empty room and no case forms, and so it was,
Yeah, I guess that was the time when people did not know what speech therapy was all about.
Yeah, and there was no training program here, so that's why I went to England. So it's been quite amazing, and I think a couple of years ago I went to a conference here where the three of us got together after, I don't know, 55 years, Dr. Rosa, Dr. Ratna and myself, and it was, I think there were about 600 or 700 speech therapists and audiologists in the auditorium that day, and we looked at each other and we said, "My God,
it's grown.
How
professionally this field has grown in India. Yes,
both in terms of personnel and in terms of technology, of course. So
Sakar learned her speech therapy in UK, and then she came here, and then she started the Nair, the very first department in India, at Nair Hospital, where I taught. And then she put up a school.
Actually, that was one of my. There was a lady, a Parsi lady called Mayor Vakil, who had a hearing impaired daughter, and who went on to do wonderful things in Washington. And Mayor got with me and with the teacher of the deaf from England, Margaret Moore. The three of us started the EAR Center, which is still going on, and I'm still associated with it. It was, I think,
wonderful work.
Yeah, and I think it was one of perhaps the first oral schools for, at that time they used to say, the deaf or hearing impaired, because Mayor, one of the few people that truly believed that hearing impaired children, if they were taught properly, would be able to listen and speak.
Yeah. Those were the times when only pocket models were available
of hearing aids.
Of the hearing aid, and we've come so far where all the Bluetooth technology and accessories are now available. And so now, gone are the days when the children actually, those who are born profoundly deaf, actually need to go to a special school. Now they can go to a normal school with all this facilities and FM system and lot of clarity in hearing aids.
And this is as small as the hearing aid can get.
Yes, you can't see it. It is as invisible as one can think.
And just one more thing. There was an Indian gentleman called Mr. Pestan Jamas who started. He was also Arfi. And today, our goal at EAR, and I think at a lot of places, is we get the children when they are virtually born, and as soon as we can, we try and integrate them, like you were saying, into normal schools, so they never experience really going to what was a deaf school before. And I think that's been.
But of course, deaf schools School for Hard of Hearing will still continue, because this hearing aids are a bit expensive. So everyone cannot afford in India. So we still require the institutions that
of course
you are running by name of EAR. Okay, and
because you see, the other thing is that there are lots of children who have other problems together with hearing impairment.
Yes.
There's
Multiple,
children,
yes.
who've got multi problems, and those children find it very difficult to integrate. So you have those children, and then of course, we use this auditory verbal method,
Yes.
which
The
has
very
great
first oral
success.
school, when she
Great.
said, it meant
Yeah.
that even with those kind of pocket hearing aids,
Yeah.
they taught children how to speak.
We never
Not-
use lip reading,
not
sign
the
language.
sign language.
Yeah. But as you say, it's not necessarily for all children.
Yes.
So there is a place for all these things,
all of them, yes.
It's,
And Sakar, I may not have told you earlier, but the way she is a proud woman to be the first speech therapist in India, I'm the proud woman to be first private practitioner lady in India. This is my 43rd year of practice. Yeah.
Both of you,
Those
of course,
times-
don't look your respective ages. Yeah.
No, those times everybody, when I studied, there were only 20 seats in India. And most of the students who passed would either go abroad or would take an institutional job.
yeah.
And so that's how I have some senior ladies who are senior to me, but they were not in private practice.
And actually, another client of yours, his wife Manik,
Yes.
Subhash, I
Yes.
think was your teacher. no?
Teacher,
Yeah,
yes,
yeah.
yes.
At Nair.
Another
Yes.
one of Dr. Vora's patients
Yes.
was is the husband of another speech therapist.
Yes.
Well,
I
that
know.
says quite a lot for your
Who was
Yes.
mom's
Pra-
teacher?
your
Manik
practice.
Dubash, yes. Yes.
Who worked at Nair for many years.
And also, I believe the speech and hearing department at Nair caught fire and completely burnt down.
Yes, recently
And-
for 3 years.
And would you like to say
Yeah,
anything
and,
about that?
We were very upset and horrified because the entire department, from flooring to walls to equipment to all the interiors, we had to do again. And I'm very thankful to Municipal Commissioner Mr. Sunil Dhamne, who saw to it that we put up a state-of-art department. The way she had put up at Nair in those times, it has again come up with a different look and state-of-the-art institute.
It
That's
wasn't very
fantastic.
state about when.
But those
beginning
times
was-
were different, yes.
it was, yeah.
Yeah, after that, I think Mr. Oza
Yeah,
did a
he
lot of...
took it to
yes,
another level.
Yes, yes.
He-
He had put a state-of-art
Yeah,
at that time,
yeah,
and now
absolutely, yeah.
once again. So it's
Okay,
very
thank
nice
you
of
both.
Thank you.
Thank you.
Thanks,
Thank you. Thank you, Shaila.
Sakar and Mali. He is a very sporting patient, and he plays an excellent
Oh
violin.
dear.
Excellent violin, and he enjoys using hearing aids to listen to music.
Between my wife and my audiologist, I am more than well taken care of. Abundant experience.
Yes. Thank you so much.
Thank
Yes.
you.